Hello wellness friends. Today we're going to do something a little bit different. As you can see, I am sitting here today with something happening to my leg, and let me tell you what happened. On February the 8th, I slipped on some ice and fell, and when I fell, my left leg got pinned under my body and I tore my quadriceps tendon. Now the quadriceps tendon is basically the tendon where the quadriceps come together and then they attach to the patella. So if that tears completely or partially tears, it interferes with your ability to extend your leg. So just imagine that if that is torn and you're in this position, you're trying to fire your quadricep, but your leg will not go to this extended position. So effectively, for my left leg, that's what I can't do. So I can't flex this, I can't extend the leg, and I can't really bear weight on the leg. Now, I've already been to the physician and they've diagnosed this, and I have my surgery scheduled for February the 15th. Today is February the 12th, so in 3 days. I thought it might be helpful for some people out there who is either going through this, or maybe in the future this video will help someone who just had the injury so that they can know what to expect. So that's why I'm making the video. But essentially, you have injuries that can have rehabilitation and you can get better, and you can have injuries that if you don't do surgery, the chances of you getting better are not great. This happens to be one of those injuries because tendons tend not to heal because there's not much of a blood supply, and if they're completely ruptured, there's no way for them to reattach to anything else in your body, so you will have a permanent disability if you don't do the surgery. So I have elected to go ahead and do the surgery, and it's something that needs to be done relatively quickly, usually 10 to 14 days after the injury. Orthopedic surgeons like to go ahead and reattach this just so that you don't have so much atrophy of the muscle and you don't have so much joint stiffness. So this will effectively be 7 days after the injury for me, so I'm under the timeline. There's two things I want to get across in this video. One is kind of how to treat the injury and what the injury entails. And number two, I live alone. So a lot of times when doctors and physical therapists talk to you about your recovery and rehabilitation, they assume you have help. Now I will have help after my surgery, but basically until then, I don't have any help. So I want to show you how to put on a immobilizer, to use your crutches and be able to do stuff when you're by yourself, and maybe that will also be of some benefit to you. So my left leg, without this immobilizer, won't tolerate any weight bearing. So a lot of times your doctor will give you one of these just so that you can wrap up the leg and keep the joint protected until your surgery or whatever you choose to do. You'll use this immobilizer on a lot of injuries, ACL tears, MCL tears, anything where you would have a unstable joint. This immobilizer might be something that the doctor wants you to use. Now there is a metal bar behind this immobilizer, and what you want to do is you want to line that up with the back of your leg. So I've kind of got this in the middle. And because I'm by myself and I'm an older person, I don't have great flexibility. But what you want to try to do is get the leg as straight as possible. And then you want to overlap part of this brace with the other part. And wherever the tag is on this, what you want to do is just make sure that that's the side that you're overlapping. So what I have here is my first strap. I'm going to pull it fairly tight around my upper thigh, and I'm going to use the Velcro at the end and cinch it on. These straps alternate going left to right and right to left. So this next strap is going to move right to left. And again, make sure I've got all this nice and cinched up, and pull this around. So this strap goes just above the top of my knee or kneecap. And then this strap will go just below where my knee would be. And then this strap would go down toward the top of my ankle. Now, to make sure you've got this fitted, it should be, the top of this should be mid-thigh or just above mid-thigh, and the bottom of it should be just above your ankle, and the straps should be just above the top of the knee, just below the bottom of the knee. So once you get the immobilizer on your leg, then you can bear weight and try to stand. So what you want to do is just situate yourself so that you can get that leg down. Now remember, it won't bend in this, so you have to help yourself sometimes with your hand or your other leg. And once you're in this position, go ahead and stand using your good leg, and put the crutches underneath. And now I can bear weight and walk around the house a little bit. So keep watching, and I'll show you how to use the crutches and get some things, not using your hands when you're by yourself. Okay, so you've got your knee immobilizer on your leg. You're up and on your crutches. You can bear some weight on your bad leg. So how do you get around the house by yourself with crutches and be able to do anything? Well, first thing you need to remember is if you have a step or you have to go up steps, just remember up with the good leg, down with the bad leg. So I have a little raised kitchen area here. It's about 10 inches high. And what I want to do is when I get here is I want to keep my crutches on the ground, put my good leg on the step, step up, bear weight on my right leg, and then bring the crutches up and support. So if I'm coming down, I do just the opposite. I come to the edge of the step, bear on the right leg, so you can see I don't have any weight on my left. Put the crutches on the ground, down with the bad leg, and then come down with your good leg and then resume bearing weight on that. When you wake up in the post-op, you will probably have something like this on your leg already. You'll probably have a compression wrap from about your ankle up to about your mid-thigh, and this adjustable brace on your leg. Now this adjustable brace will be with you for the entirety of your rehab, so get used to it being on your leg. It adjusts because when you come out of surgery, you're going to have some swelling in your knee, and this will adjust to accommodate for that swelling. Plus, as the doctor or physical therapist wants you to progress through knee flexion, they can lock this at certain degrees so that it will allow you to flex to those degrees, but not beyond that, which will be good for your rehab. So just quickly, let me show you how this works. So you've got 4 Velcroed clasps that go on this, and you can see on the side there is an adjustment that you can make by pushing in the button and then adjusting it to whatever degree of flexion that you want it to go to. So that'll be helpful to you as you're doing your rehab. when you put these on, just make sure that the adjustments are at about where your knee hinges. So for me, I just pull it up to about here, and then you go ahead and put these clasps back on. They have a Velcro to make them easy to cinch up tighter or to make them looser, and they Velcro right on. So it's a fairly quick operation. You won't have to have any help doing this. So once you have it back on, you can stand with this brace on. So after surgery, your leg will be straight, it just won't bend. So you can bear weight with your crutches, you can bear weight with this brace on, so you'll be able to get around okay. It's just the bending that's going to be the part of rehabilitation that you'll focus on. And that'll start anywhere from 7 to 14 days after your surgery. They'll want you to start doing some bending of the knee. And another component of your rehab will be ice, and I'll show you how the Game Ready works and how to turn that on and how to put that onto your leg as well. Okay, so here is our Game Ready unit. And to use this, you just need to be able to fill this compartment with ice and water and fill it up until about the top. There's an indicator line that you can use. And then just make sure that you have your power into the port on the Game Ready. And then this is the basically where the water is pushed through and also the air is pushed through. So just make sure that is in there. And then you use the power button here to turn the unit on and off. So we're going to turn it on. We're going to set the pressure or compression here. So the farther the lines move across, the more pressure. And then you set your time. So if you're going to do 30 minutes, just toggle that to 30 minutes. And when you're ready to go, there's a start-stop button here. You push. And that turns the unit on. Now I'll go ahead and put this on my leg so you can see how that works as well. Okay, so here's the Game Ready pad that you'll use. Just make sure when you put it on, you have this nozzle coming out towards your ankle. So what you do is you just wrap it up over your knee like this. Get that on and then turn on your machine. And you can feel the water circulate through the leg, and you can feel the compression start. And this will be good to use when your injury is acute and you have some pain, but it'll be also good to use after your therapy. When you begin your therapy, your knee will probably hurt a little bit, so this will be good to use for that as well. In regards to pain, after your surgery, the second and third day, you're going to have a lot of pain because the anesthesia and the nerve block will wear off. But after about 4 or 5 days, the pain subsided for me, and I was able to control it with over-the-counter pain medication. So ice, over-the-counter pain medication will probably get you through in regards to pain, and then just do your therapy and hopefully you'll get better. So I'll do another video on beginning therapy for the leg and some of the exercises that you'll do for that. So just check out the next video and I'll see you then.